Many seniors think of high blood pressure as a slow building concern, but in reality, what feels stable still carries silent risks. The body adapts, arteries tighten, and often the first visible sign is not a reading on a machine, but a stroke that could have been prevented. Because according to a large meta-analysis in The Lancet, every 10-point increase in systolic blood pressure raises the risk of stroke by 45% in older adults. That's why the smallest reductions, even just 5 points, can dramatically improve outcomes, which is why you should listen to today's conversation. Welcome back to the Senior Health Podcast. Today, Japan's oldest doctor will share the best 5-minute habit he recommends to seniors each morning, which can significantly reduce blood pressure and thus help prevent stroke. Doctor, these 5 minutes are so important, right? Yes, they are, John, and I'm happy we are having this conversation because high blood pressure is not always loud. In fact, nearly 1 in 4 adults with high blood pressure do not know they have it at all. It builds quietly beneath awareness until the body begins to carry tension it can no longer release. So, in today's episode, I will share how 4 simple steps can relax that tension, lower pressure naturally, and signal the nervous system to protect the brain from stroke. And if stroke prevention is something you've thought about, type 1 in the comments and let us know if you're aware of your own blood pressure. That already hits home for me. I know many seniors who live with mild or borderline blood pressure and think it's not urgent, but I've also seen how quickly things can change, often without warning. What do you tell your patients when the numbers don't yet seem dangerous? I remind them that pressure alone is not the enemy. It's pressure held too long, too tight, without relief. And that's where the real danger begins. That reframe is powerful because many older adults are waiting for symptoms, headaches, dizziness, red flags. But what you're saying is that the most serious risks often grow quietly before anything feels wrong. Exactly. And the brain is especially sensitive to this. It cannot tolerate even short drops in blood flow. So when pressure becomes unstable or vessels lose a flexibility, the risk begins to rise, even if it has not yet crossed the threshold doctors call hypertension. That really shifts the timeline. It means intervention needs to begin long before medication is prescribed. But if blood pressure builds silently, how do we catch it early enough? By listening to what the body shows us, John. Subtle fatigue, restlessness, a sense of being off balance. The earliest signs are rarely pain. They are rhythm shifts, and they respond best to rhythm-based habits. That word rhythm, I keep hearing you return to it. Is that the key? That stroke risk is not just about numbers, but about a loss of natural rhythm in the body. Yes, because when rhythm is lost, the vessels become confused. The nervous system stops coordinating blood flow efficiently, and over time, pressure rises not from force, but from friction. That's something most seniors aren't told, that the real warning may not be a spike in numbers, but a breakdown in regulation. So if stroke risk begins with that loss of rhythm, how does blood pressure fit into the picture? That's the hidden part, John. Because long before a stroke ever occurs, the pressure inside our vessels begins to shift. Even a slight steady rise can weaken the lining. It damages from the inside out, without symptoms, without pain. And that's how it begins. Yes, stroke risk begins with pressure. Not sudden pressure, not crisis, just quiet chronic strain on the walls of the arteries, the kind most seniors never feel. So even if the numbers aren't sky high, the risk is already climbing. Exactly. A systolic pressure in their 130s or 140s may not alarm doctors, but after 60, even that mild elevation can double the long-term risk of stroke. And many seniors live in that range for years without knowing what it's doing to the brain. That changes everything. It means prevention has to start earlier, not with medication, but with awareness. Yes, because when pressure builds slowly, it does not speak in symptoms. It speaks in where. And that where is what we are trying to reverse, right? So what's the first thing we can do right now today to start lowering that pressure and protecting the brain from stroke? Start by giving the body a signal of safety. Before movement, before anything else, you sit, soften your shoulders, and take 6 slow breaths. Inhale gently through your nose for about 5 seconds. Then exhale through your mouth for 5 more. That already sounds calming, but why does it matter so much? Because the breath is how the body listens to itself. When we breathe fast, shallow, or hold our breath, the nervous system thinks we're in danger. But when we breathe slowly and evenly, it tells the brain, you're safe now. That alone can begin to lower blood pressure. So just 6 breaths, that's all it takes to create that change. Yes. In fact, Japanese researchers studied over 20,000 adults and found that just 6 deep breaths in 30 seconds caused an immediate drop in blood pressure. Systolic pressure fell by up to 10 points. And it worked best in seniors with already elevated readings. That's why it's now part of Japan's national hypertension guidelines. That's incredible. I don't think most seniors realize breathing alone can create that kind of shift. And no equipment, no pills, just presence. Exactly. We forget how powerful stillness can be. Breath work activates the vagus nerve, the part of your nervous system that tells your heart to slow down, your vessels to relax. When that signal is strong, the whole cardiovascular system begins to ease. And the idea is to start the day this way. Yes. Before coffee, before the news, you sit upright, feet flat on the ground, and you begin. Each breath softens the tension that may have built overnight. Each breath reminds the body not to fight, but to flow. There's something beautiful about that, like you're giving your body permission to begin again softly. I imagine that kind of start changes how the rest of the day feels. It absolutely does, and I've seen it in my patients. And one woman told me her mornings used to begin in a rush. Phone in hand, television on. Now she sits by the window and breathes. After 1 month, her pressure dropped 7 points without changing anything else. That's the kind of story people need to hear. It's not just numbers. It's that feeling of being in control again, of remembering that our body can still respond to something gentle. And breath is the gentlest. It enters without force and leaves without trace. But its effects, if repeated daily, are lasting. So now that we've taken that first breath, what's the next signal we send the body? How do we keep that rhythm going? Once we rise, once you've breathed, you rise. Not to rush, but to move with purpose. Just 1 minute. Marching in place. Slowly lifting the knees. Swinging the arms like you're waking up the rhythm of the blood. That's so simple. Almost too simple to believe it matters. And yet it does. The vessels need movement to stay elastic. When you walk, march, or do a gentle radio calisthenics routine, the endothelium, that thin inner lining of your arteries, begins releasing nitric oxide. This tells the vessels to expand, and expansion is how pressure softens. I've always thought of walking as good for the heart, but you're saying it's also speaking directly to the vessels. Yes, and not just the big ones. Even the small peripheral arteries respond. A study from the University of Sydney in 2022 found that just 5 minutes of light movement a day, not workouts, just movement, was enough to reduce systolic pressure in adults over 65. That's why millions of Japanese seniors start their mornings with Rajo Taiso. It's not exercise, it's awakening. You've shown me videos of that before. The whole town moving together. It's beautiful. I think some seniors here feel like movement only counts if it's hard, sweaty, or structured. But this is different. That's the Western mistake. We confuse effort with benefit. But what blood wants is circulation. And circulation comes from rhythm, not exhaustion. That really lands. It reminds me of a patient who couldn't walk far but started marching lightly at the kitchen counter each morning. His blood pressure dropped nearly 10 points in a month. He thought it was a fluke. It wasn't. When you move rhythmically, even for a minute, you are giving your body the memory of motion. You're reminding it how to circulate, how to regulate. Seniors who do this daily often find their balance improves too because the body begins to coordinate again. That connection between movement and regulation, it's more powerful than I realized, and it makes me think once the body is in motion, how do we start building strength within that softness? That's when we begin the quiet work, the part most people skip, but where real pressure control begins. What do you mean by that quiet work? Something physical or something more internal? Let me explain. The third step is physical but very quiet. After breath and movement, we give the vessels a chance to relearn strength without strain. That's where the simple hand squeeze comes in. That surprises me. Something so small coming after movement feels almost understated. And that's exactly why it works. You take a soft ball or even a rolled towel and squeeze it gently with one hand at a time, about half of your strength. You hold for 30 seconds, then rest for a short moment and repeat this 2 times on each hand. There's no rushing, no straining, just steady pressure that teaches the arteries how to respond without panic. So, we're not talking about gripping hard or pushing limits, right? No, never. I hear that a lot. That effort must be intense to matter. But with isometric squeezing, the body learns control. The blood pressure sensors in the vessels, what we call the bear reflex, begin to respond more calmly. Over time, that lowers resting pressure. That's fascinating. You're strengthening the system that senses pressure itself, not just forcing it down. Exactly. Multiple clinical studies have shown that regular hand grip exercises can lower systolic pressure by 6 to 7 points, sometimes more. That's comparable to the effect of a first medication, but without side effects. And for frail seniors, it's safe because you can do it seated, breathing normally without stressing the joints. I can already imagine seniors feeling relieved hearing that. No special equipment, no fear of falling, no pressure to perform. And I've seen the relief firsthand. One gentleman in his 70s told me this was the first time a doctor gave him something he could do while watching the evening news. After 8 weeks, his readings came down enough that his doctor delayed adding medication. That must feel empowering, like they're finally part of the solution instead of just reacting to numbers. Yes, and that sense of agency matters more than we realize. When seniors feel capable, the nervous system softens further. The body stops bracing and pressure responds not just to the exercise, but to the confidence that comes with it. There's something deeply humane about that. Strength without strain, control without force. It feels like the routine is slowly guiding the body into balance. And once that balance begins, we don't stop abruptly. The body needs a clear signal that the work is done and that it's safe to rest. That final signal is often the most overlooked. That makes me curious. If the body has been breathing, moving, and gently strengthening, how do we close it in a way that helps all of that settle in? The last step of this 5-minute habit is hydration. Just a cup of warm water, or even better, hibiscus tea. It tells the body, you've done enough, now rest. I love that. It's like a bow tied around the whole practice. Exactly. Hibiscus contains natural compounds that work like gentle ACE inhibitors. They relax the vessels and encourage lower pressure, especially when taken consistently. And when it's warm, it soothes the digestive tract, helping the body absorb more of the ritual itself. I've recommended hibiscus before, but mostly in capsules. There's something more grounding about the tea itself. Do you prepare it in a specific way? I do, and it's very simple. Just take 1 teaspoon of dried hibiscus petals steeped in hot water for 5 to 7 minutes without any sweetener. Just let it cool slightly before drinking. Seniors with very low pressure or who take antihypertensives should check with their doctor first, of course, but for most it's a beautiful, safe habit. That's such a small touch, but it feels meaningful. I imagine sitting with it quietly after the practice, just allowing everything to settle in. That pause matters. You are telling the nervous system, no more alarm, no more chasing, just peace. And when that becomes part of the memory of each morning, the body begins to carry that calm forward. There's something so complete about it. Breath, movement, strength, stillness. It feels like all the systems are finally talking to each other again. And that is when the real shift begins. Not just in blood pressure, but in how the brain and body relate to time, rhythm, and presence. That's beautifully said. But now I have to ask, how often should someone do this? Every day at the same time. How do we make it stick? every day if you can. Preferably in the morning before distractions gather, before the blood pressure begins its natural climb. You want to give the nervous system its rhythm cue early so it can carry that message all day. And 5 minutes is enough because it's not just a routine, it's a reminder. I like that. It becomes less about the activity itself and more about the message you're sending the body. Exactly. That's the real medicine. Not the squeeze or the march or the tea, but the rhythm, the repetition. When the body begins to expect calm, it responds more quickly to it. That's how pressure shifts from being managed to being remembered. That's a beautiful note to end on. To everyone listening, thank you for spending this time with us. And if this episode helped, take a moment to like it, leave a comment, and subscribe. Oh, and watch this next video right now. Yes, please. We've picked this one especially for you.